High cortisol levels, also known as hypercortisolism or Cushing syndrome, can cause a range of physical and mental health issues. Cortisol is a hormone produced by the adrenal gland, and it plays an important role in the body's stress response. However, when cortisol levels remain high for an extended period of time, it can have detrimental effects on the body. In this video, we'll explore the 8 warning signs of high cortisol levels and discuss some of the potential causes and treatments for this condition. Number 1. Weight gain. One of the most common symptoms of high cortisol levels is weight gain, particularly in the abdominal area. Cortisol is responsible for increasing blood sugar levels, and when cortisol levels remain elevated, the body may store the excess glucose as fat. High cortisol levels can also cause an increase in appetite and cravings for sugary or fatty foods. Number 2. Insomnia. Cortisol is involved in regulating the sleep-wake cycle, and high cortisol levels can interfere with this process. People with high cortisol levels may experience difficulty falling asleep or staying asleep throughout the night. This can lead to daytime fatigue, decreased concentration, and other issues related to lack of sleep. Number 3. Mood changes. Cortisol plays a role in regulating mood and emotions. High cortisol levels can cause irritability, anxiety, and depression. People with high cortisol levels may also experience mood swings, difficulty handling stress, and a decreased interest in activities they once enjoyed. Number 4. Muscle weakness. Cortisol is involved in the breakdown of muscle tissue. When cortisol levels remain high for an extended period of time, it can lead to muscle weakness and atrophy. This can cause difficulty with physical activity and can also contribute to the development of other health issues, such as osteoporosis. Number 5. High blood pressure. Cortisol can cause blood vessels to constrict, leading to high blood pressure. Prolonged high cortisol levels can increase the risk of hypertension and other cardiovascular diseases. People with high cortisol levels may also experience headaches, dizziness, and other symptoms related to high blood pressure. Number 6. Increased thirst and urination. High cortisol levels can cause an increase in urine output, which can lead to dehydration and an increased feeling of thirst. People with high cortisol levels may also experience dry mouth, constipation, and other symptoms related to dehydration. Number 7. Acne and skin changes. High cortisol levels can lead to changes in the skin, including acne, thinning of the skin, and easy bruising. People with high cortisol levels may also experience an increased susceptibility to infections, as cortisol plays a role in the body's immune response. Number 8. Slow wound healing. Cortisol plays a role in the body's inflammatory response. High cortisol levels can interfere with this response, leading to slow wound healing and an increased risk of infection. People with high cortisol levels may also experience other symptoms related to inflammation, such as joint pain and stiffness. If you're experiencing any of these symptoms, it's important to speak with your healthcare provider to determine if high cortisol levels may be the underlying cause. Treatment options for high cortisol levels vary depending on the underlying cause, but may include medication, lifestyle changes, or surgery in more severe cases. In addition to these warning signs, there are also certain risk factors that may increase the likelihood of developing high cortisol levels. These risk factors include chronic stress. Prolonged exposure to stress can cause cortisol levels to remain elevated, leading to the development of high cortisol levels. Medications. Certain medications, such as corticosteroids, can lead to high cortisol levels. Adrenal gland tumors. Tumors of the adrenal gland can cause the gland to produce excessive amounts of cortisol. Pituitary gland tumors. Tumors of the pituitary gland can cause the gland to produce excessive amounts of adrenocorticotropic hormone, ACT, which stimulates the adrenal gland to produce cortisol. Gender. Women are more likely than men to develop high cortisol levels. Thanks for tuning into our video on high cortisol levels. If you suspect that you may have high cortisol levels, it's important to speak with your healthcare provider to get an accurate diagnosis and appropriate treatment. With the right approach, it's possible to manage high cortisol levels and prevent long-term health complications. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more informative content like this.